Welcome to our informative video series, Hypertension, Another Silent Killer. In today's episode, we'll be exploring the critical issue of hypertension, a key factor in maintaining optimal health and wellness. In our dynamic, constantly changing world, understanding and managing hypertension is essential for a healthy life. This video delves into the science of hypertension, its effects on the body, and effective ways to manage and prevent it. If you're looking to navigate your health journey with informed confidence, this video is tailored for you. Remember to like, subscribe, leave a comment, and click the notification bell for more engaging content about making wise decisions for your health. Join us on this insightful voyage to comprehend and control hypertension. Always consult a healthcare professional before implementing any significant lifestyle adjustments. We're exploring the unseen world of hypertension, a quiet yet potent condition often underestimated. Hypertension, colloquially known as high blood pressure, is an intriguing yet bothersome health condition. It's a bit like the distant relative who overstays their welcome at family gatherings. You might not notice them at first, but eventually their presence can't be ignored. Hypertension, in essence, is a situation where your blood decides to throw a rave party against your artery walls. The increased pressure of this relentless celebration can, over time, lead to severe health issues, including heart disease. Picture it as a water hose. When the pressure is too high, it can damage the hose over time. Similarly, when blood pressure is too high, it can harm your arteries and your heart. Now you might be wondering, why should I care about hypertension? Well, it's more common than you might think. It's a global health concern, affecting a significant portion of the adult population worldwide. Hypertension is often likened to a silent killer. It sneaks up on you quietly without any obvious symptoms, and if left unchecked, can lead to severe health complications. It's a bit like that sneaky plot twist in your favorite thriller movie, except in this case, you don't want to be caught off guard. Therefore, regular checkups are crucial for early detection. The good news is that hypertension is manageable, and with the right approach, its effects can be mitigated. So, now that we've introduced this silent but potent party crasher, you might be wondering, what causes hypertension, and how can I prevent it? Good questions. In our next segment, we'll dive into the causes of hypertension, exploring everything from genetics to lifestyle factors. Remember, knowledge is power. The more you understand about hypertension, the better equipped you are to manage it. Now that we've established what hypertension is, let's delve deeper into its causes. Hypertension can be caused by many factors, some within our control, others not so much. Let's unravel some of these causes. A diet high in salt can increase blood pressure, making your heart work overtime. Being a couch potato doesn't help either. Regular physical activity can help lower blood pressure, so get moving. Now let's talk about stress. It's not just about being frazzled. Chronic stress can lead to unhealthy habits that contribute to hypertension. And what about genetics? Yes, they play a part too. If your parents or grandparents had hypertension, you might be more likely to develop it. Don't forget about chronic conditions like kidney disease, which can also heighten your risk. And then there's obesity, tobacco use, and excessive alcohol consumption. Each of these factors can push your blood pressure up into the danger zone. Understanding the causes helps us identify possible changes we can make. But first, let's look at the symptoms. The silent killer, as it's often called, is secretive indeed. Hypertension frequently goes unnoticed until it's too late. Picture this. You're walking around feeling fine, living your life, but inside your body, there's a silent battle going on. The pressure of your blood against your artery walls is higher than it should be. This might not sound like a big deal, but over time it can lead to serious health issues. Hypertension is often referred to as the silent killer, because it usually doesn't present any symptoms. You don't feel any different, you don't look any different. It's not like a runny nose or a cough that alerts you that something's off. That's why regular checkups are so important. They're like your secret weapon against this silent enemy. Now you might be wondering, what's the worst that could happen? Well, let's talk about that. If left unmanaged, hypertension can lead to a heart attack or stroke. The high pressure can cause a section of the heart muscle to be starved of oxygen, which can result in a heart attack. Similarly, it can cause a blood vessel in the brain to rupture or be blocked by a blood clot, leading to a stroke. Furthermore, hypertension can lead to an aneurysm. This is when the constant pressure causes a weak spot in your blood vessel to balloon out and potentially to rupture. It can also cause heart failure, where the heart can't pump blood as well as it should. And kidney problems, where the arteries become weakened or narrowed. If that's not enough, hypertension can also affect your eyesight by causing thickened, narrowed, or torn blood vessels in the eyes. It can also lead to metabolic syndrome, a cluster of conditions that increase the risk of heart disease, stroke, and type 2 diabetes. With the severity of these complications, it's clear why prevention and early detection are key. Let's see how we can achieve that. Prevention is better than cure, especially when dealing with hypertension. Now you must be wondering, how can we prevent something that doesn't show explicit symptoms? Well, it's all about embracing a healthy lifestyle and regular monitoring. Let's start with the diet. Consuming a balanced diet low in salt and saturated fats is a great preventive measure. Think fresh fruits, vegetables, lean proteins, and whole grains. It's time to say goodbye to processed foods that are often high in sodium and unhealthy fats. And don't forget, drinking plenty of water is equally important. Next, let's talk about exercise. Regular physical activity is a boon for your heart health. It doesn't mean you need to run a marathon or lift heavy weights. Even brisk walking, yoga, or dancing can do the trick. Aim for at least 30 minutes of moderate activity most days of the week. Weight management goes hand in hand with diet and exercise. Maintaining a healthy body weight can significantly reduce the risk of developing hypertension. It's not about drastic weight loss, but achieving and maintaining a weight that's healthy for your body type and age. Limiting alcohol intake is another preventive measure. While occasional sipping won't do much harm, excessive drinking can increase blood pressure levels. So, it's best to keep it moderate. And of course, if you're a smoker, quitting is a must. Smoking damages blood vessels, leading to hypertension and other health issues. Yes, quitting is hard, but think about the benefits. It's a life-saving decision. Lastly, don't forget about regular blood pressure monitoring. Regular checkups can help detect any rise in blood pressure early, allowing for timely intervention. Remember, these preventive measures don't just help fend off hypertension, but also contribute to overall health and well-being. It's like hitting multiple birds with one stone. Prevention is one aspect, but what if you already have hypertension? Don't worry, there are ways to manage it. But that's a discussion for another day. For now, let's focus on prevention because as they say, it's better to build a fence at the top of the cliff than to park an ambulance at the bottom. Being diagnosed with hypertension isn't a dead end. With the right approach, it can be managed effectively. So, what does the right approach look like? Let's delve into it. Firstly, lifestyle modifications sit at the heart of hypertension treatment. This involves a healthy diet, rich in fruits, vegetables, lean protein, and whole grains. Limiting sodium or salt intake can also make a significant impact. Imagine this, you're not just sprinkling less salt on your meals, but you're also kicking the canned and processed foods off your grocery list. Sounds like a win-win, right? Next, let's talk about physical activity. Regular exercise is key. It doesn't have to be a marathon or heavy weightlifting. Simple activities like brisk walking, swimming, or cycling can do wonders. Aim for at least 30 minutes of moderate exercise most days of the week. It's like signing a peace treaty with your heart. Then we have weight management. If you're overweight, shedding even a few pounds can lower your blood pressure. It's like taking a load off your heart, quite literally. Limiting alcohol intake and quitting smoking are also crucial. Think of it like giving your body a well-deserved break from harmful substances. Now, lifestyle changes are important, but sometimes they may not be enough. That's where medications come in. There are multiple classes of drugs available, each working in a different way to lower blood pressure. Your healthcare professional will determine the best fit for you, based on your health history and current condition. Finally, regular monitoring and checkups are integral. It's like keeping an eye on a sneaky enemy. You need to know what it's up to. Regular checkups help in adjusting treatment plans if required, and also in catching any potential complications early. Remember, managing hypertension requires consistent efforts and regular medical attention. It may seem challenging at first, but with time, these changes can become a part of your routine, leading you towards a healthier and happier life. Hypertension, the silent killer, isn't as daunting when we understand it. It's a common condition resulting from factors such as poor diet, lack of physical activity, obesity, and stress, among others. Yet, it often goes unnoticed due to its silent nature, making regular checkups a critical part of its early detection and management. Remember, hypertension can lead to severe complications such as heart disease or stroke if ignored. It can also be both a cause and a result of other conditions like type 2 diabetes, but it's not all doom and gloom. With lifestyle changes like a healthy diet, regular exercise, weight management, and limiting harmful habits, we can prevent or manage this condition effectively. Treatment options, including medications and regular monitoring, can also help keep hypertension in check, so it is crucial to stay informed and take proactive steps towards your health. Thank you for watching. Stay informed, stay healthy, and remember your health is in your hands. Disclaimer: this video is solely for educational and informational purposes and should not replace professional medical advice. We strongly urge consulting with healthcare professionals for tailored advice and before making any substantial changes to your health or lifestyle. Stay informed, stay healthy. Don't forget to hit the subscribe button and the notification bell for our latest health and wellness content. Your health is important to us.